Hey everyone, I'm very excited to be here with you today and presenting on genomic literacy. This is a topic near and dear to my heart. My name is Carrie Oxencis. I am a pharmacogenomics clinical pharmacist for Froedtert Health, and I'm also a clinical associate professor for the Medical College of Wisconsin School of Pharmacy and also the graduate school. My background is in oncology, so very interested in oncology genomics, pharmacogenomics, and also patient care. So this topic is close to my heart, and I hope that it's very beneficial for you all, and we learn a lot together today. I do not have any relevant financial relationships or other disclosures to share with you today, nor do any of the planners for the CE activity. So for our learning objectives, this program is being offered for both pharmacists and pharmacy technicians. And after completion of this program, learners will be able to define health literacy and genomic literacy, describe the role of the pharmacist in genomic patient education, and identify opportunities for pharmacist-led provider genomic education and communication. So let's start off with some definitions and level set and make sure that we all know what we mean when we say genomic literacy. So you may be familiar with the term health literacy. And that is the degree which individuals have the capacity to obtain, process, and understand basic health information and services, and then use that information to make appropriate health decisions. And the Pharmacy Society of Wisconsin and pharmacists as a profession have really tried to make an effort to promote, encourage, and improve health literacy because it's so important for our patients to understand their medications. Health numeracy takes that to the next step, and that's an individual's capacity to access, process, and interpret and act upon what's called probabilistic health information. So those are numbers that we use as statistics, the chance out of a certain number that you might experience an event, and using some of those numbers to accurately predict or forecast health outcomes. It's a little more complex, but often used during clinical consultations with various healthcare providers to explain the likelihood of an event happening. And then we move on to genomic literacy, which is the capacity to obtain, process, understand, and use genomic information for health-related decision making. So throughout this presentation, you'll hear me say the words genomic, genetic, pharmacogenomic, pharmacogenetic, basically referring interchangeably to the same thing, referring to genes or the backbone of your DNA and how that can influence your healthcare. So as you can imagine, this can add an extra layer of complexity when we think about health literacy. And the goal really is to identify patients easily and quickly who have lower health literacy or genomic health literacy. But that is a challenge. We have some tools to use, and I'll go over a few examples of those. But I do want to highlight and preface this topic that education level or how many years of school someone completed doesn't always tell the full story. Age or physical appearance are also not reliable measures. So, just be careful as we always do, making assumptions based off of how a patient appears to you. And what's really impactful about this scenario is that individuals hide or adapt literacy challenges. This is something associated with somewhat of a societal stigma. Patients don't share when they feel like they're challenged or not understanding things relating to literacy. There was a study done back in 2002 that showed 67% of patients with low literacy never told their spouse over half never told their children. And even when placed in situations where sharing, I might not be understanding this information would be very helpful. And even in a non judgmental situation, almost 20% of people with health literacy challenges did not tell anyone. So can be somewhat of a silent issue. So good that we're focusing on this today, and something to keep in mind when you interact with patients as part of the pharmacy team. So what are the implications of genomic health literacy? So as you might imagine, higher literacy or higher understanding will improve informed decision making regarding genetic testing options and also what to do with those test results. And then conversely, a low genetic literacy is expected to negatively impact understanding of genetic testing and how that folds into the treatment plan. So when patients don't understand what's happening, that can lead to all sorts of negative consequences. So the thing that we're worried about, of course, with medications is not taking the medication as instructed, or calling when a side effect is experienced. Not following up with testing if the importance of that testing isn't well understood, or even some preventative screenings. There are different conditions or different predictions we can make regarding especially medication efficacy and side effects that are very important. But with low genomic health literacy, we'll have patients who might not understand the benefit and then not follow through with that testing. A couple examples. We have a variety of scales and assessment tools we can use in the clinic. Uh, full disclosure, literacy tools aren't commonly used in everyday clinic appointments. There are a variety of other, assessments that take place, but there are some available. So if you're interested in using some in your practice, or you want to do a little deeper digging into a project, I wanted to share a few examples. There is a test called the Real G, and that's a rapid estimate of adult literacy in genetics, modeled after an adult literacy test. And what this involves is watching a pre-recorded video and answering a series of questions afterwards. And so this study that looked at and validated this test did identify that the sixth grade reading level or below was identified as a cutoff for lower genetic literacy scores. So in this case, that was a correlation. There's also something called the gene lift, or a genetic literacy fast test. And that's also another one designed to rapidly screen genetic literacy levels. And this one is more of a self-reflection. So test takers were asked to self-rank their genomic knowledge, evaluate accuracy of statements about genetic testing, and then they were also tested on recognition of genetic terminology. And that's going to be a common theme throughout this presentation. What are these words and do we know what they mean? And that's going to apply for our patients, for the pharmacists, and for other healthcare providers. So this validation of this assessment tool found that association with genetic knowledge was independent of health literacy, numeracy, and education. But overall, genomic medicine concepts were poorly understood, even after adjusting for education level. When we get into some of these terminology and concepts, it's understandable why this is not something that's widely known, widely discussed. We may have had some of this education back earlier in the past, but it's hard to recall that in real life. And that's what this assessment tool found. So there's been investigations into scaling genomic literacy. So what are the steps that we need to take as healthcare providers and, interpreting that as pharmacists to make sure that patients do have this skill set? And what are those skills? So this group found that individuals need a combination of being familiar with genomic terminology being able to use that information and also apply facts to decisions. So the stepwise process to that learning was called, awareness, how to, and then to apply decisions. And so what we're going to dig a little deeper into is step one. So what can we do as pharmacists if we are not upskilled? And then how can we help our patients and the providers that we work with understand genomics and pharmacogenomics? So the first step is really familiarity with genomic terminology. So these are some of the words that this group looked at when, assessing, is this a familiar term to you? And so the words in green are the words that the participants routinely recognize. So the words genetic and hereditary were familiar. The words in the middle, which are words that are going to pop up in our upcoming slides, mutation, variation, susceptibility, those were a little more confusing. And ironically, the number one word that was most confusing and people were least familiar with was the word sporadic. And that's not even a word necessarily specific to genomics, but it's more of a complex, a word that we use in the English language, which really speaks to trying to use plain language when describing some of these complex topics. So interesting results here, but gives us a little guidance on where to lean in on and make sure that we all understand the terminology. So I did want to call out, a big chunk of my clinical practice throughout my career has been in oncology, and genomic literacy in oncology has an extra layer of complexity because we are looking at genetic testing not only for cancer treatment, but also for inherited disease risk and other inherited genomic variants. So again, just very multifactorial, and a really common terminology thrown around in that practice area is precision oncology or precision medicine. But interestingly enough, when a team looked at this, 2/3 of patients had no idea what precision medicine meant. It can mean a lot of things. We've heard it since President Obama was in office, and there was the cancer moonshot, and he launched some, pretty exciting precision medicine initiatives, but a lot of variation in what that covers, what that means, and what we dig into. And adding to that is there are so many different words that have been used in the literature and clinical trials to describe biomarker and genetic testing for cancer patients, and even included in education materials. So just for context, patients are seeing words like molecular testing and tumor profiling, somatic testing, genomic testing, all over the patient information they're being handed as a cancer patient. Keeping in mind, some of the top causes of death in the United States are cardiovascular disease and cancer. So no matter what practice area you work in, whether it's retail or specialty pharmacy or hospital practice, you are interacting with patients with cancer. So very important context for everyone that this is also an area of confusion, and these types of words are being used to describe some of those tests as well. So there are some consensus recommendations to talk about testing specific to oncology. So for your information, I just wanted to share this with you. So the preferred terms, biomarker testing, is specifically meant to refer to acquired alterations in the DNA of cancer cells. So this is when our cancer cells have, something's off, something is wrong. They are growing out of control. They have become cancerous, and we're using tests to test those tumor cells to figure out what the best treatment would be. So that's biomarker testing. Genetic testing is the recommended term to talk about inherited variations of genes. So that's testing for cancer risk. This is what have we inherited from our mom and dad. So this is sperm and egg, also called germline genetic variants. So that is what genetic testing is recommended to be used to refer to that type of testing. And this is the type of testing that, as pharmacists, clinicians, we typically think of when we think about genetic testing. But just a call out for the oncology folks and our cancer patients. All right, so what are some of the implications for health literacy, specifically regarding genomic testing? There are a whole host of things that genetic literacy affects. So patient and provider communication, does the patient understand what the provider is trying to tell them about their disease and their, plan of care when in those visits, if we're using genetic terminology? Informed consent is also a very important aspect of care. A lot of treatments and regimens, depending on the sensitivity and the acuity, patients might need to sign informed consent or to participate in a clinical trial. So can true informed consent be given if patients do not understand what the words mean and what they're signing? A general concern, but also specifically for genomic literacy. What are the risks and benefits of testing and the goals, costs of testing, and then into the interpretation of test results and delivery of test results. And we're going to talk about some examples and best practices for that as we talk to patients as pharmacists. And then how are we providing education to patients? Is it verbally? Is it visually? Is it written down? What do those look like? And what resources can we give patients so that they can self-service and also advocate for themselves? So as you can see, just a lot of aspects throughout the continuum of care that are affected by genomic testing. All right, so let's dive into some patient education and communication together. Let's start off with some tips. So first and foremost, if in doubt or if a caregiver is heavily involved in someone's care, try to have an education session where they are present. This is true for any type of education, but especially important for genomic literacy. Uh, when people go home and try to explain things to their family members or to their significant others, uh, there's often a lot of questions, especially with genetic testing. So, I always welcome everyone at an education visit to make sure that all of the questions are answered. Really thoughtfully think about what are the top 3 things you want your patient to take away from this session. There's a whole lot you can talk about with genetic test results, but what are the top 3 things, especially regarding safety or any changes that they might need to make? Really clearly written education materials. This is an area that's still in development, and not all practice sites may have this built in. So I'm going to give you some resources at the end for recommended materials if you don't have those, grassroots created yet in your clinical practice. But these need to be very clearly written using, shared terminology. And when you're explaining any of these test results or testing, speak slowly and reinforce as needed. Don't be afraid to pause regularly and check for comprehension. Try to summarize and use visual aids. A lot of people are visual learners. So if you can explain a concept with a picture, that's very helpful. And also confirm understanding. So that's our tried and true teach back method. Always make sure to ask open-ended questions at the end to ensure that the patient understands what you just went through. All right, so if we're not going to use one of those, validated tests to officially assess genomic literacy, what are some other cues that you can use to try and gauge how well, and how deep comprehension is? If a patient does not have any follow-up questions, it could be multifactorial. They might be overwhelmed or anxious. They might already know the answers, but that is a sign that they might not have fully understood what you just explained. So if that happens, always give time and reinforce and ask a second time, do you have any questions? Um, Patients who are unable to provide names and indications for their medications or have any adherence issues that you've identified, either with their medication regimen, tests, or referrals, there might be a component of literacy deficit there. Again, could be multifactorial, but pause and reassess. And if patients have incomplete forms filled out, that's another cue. Again, it could be from skipping through, rushing through, or anxiety. But often, if people are not filling out forms as directed, it could be because they weren't able to read the directions. So again, just a couple cues to pause for a literacy check. So, what exactly are we doing during a pharmacogenomic counseling session? What are the types of things that we are covering as pharmacists if we are put in the situation where we've either ordered the test or we're being asked to interpret a test that perhaps a patient brought in? So, as a pharmacist, what our role includes is reviewing those results. And we need to be looking for drug-gene interactions and drug-drug-gene interactions. So I encourage you all, we all learned, drug-drug interactions, drug-herb interactions, drug-lab interactions, especially for those of us, including myself, who maybe went to school a few years ago. But I want you all listening to also add check for drug gene interactions to your medication profile review. Just as important and can be just as impactful to care. If those tests indicate that there should be a medication change, we should provide that education. And are there any future implications for testing? You could have a test result that would impact a medication that a patient's not on right now, but in the future they could be. So explaining the benefits of that can be very helpful. Evaluating comprehension. Put that in big and bold. Don't forget that step of our education, and then providing that copy of results to take home. So let's look at some specific examples because we are champions of the right patient, the right drug, the right dose, and the right time. But what are the right words? So we talked about how precision medicine is a really ambiguous term for a lot of patients, for both cancer patients and patients in general. So a potential alternative could be treatment plan designed specifically for you, based off of your unique characteristics, your DNA. This is a plan for you. So that's an easier way to perhaps understand what that means from the patient perspective. Pharmacogenomics. Uh, there's a large national study going on from the National Institutes of Health looking at genomic data called All of Us. Some of you may have heard of that, and there are multiple sites in Wisconsin that offer that testing. And they also have surveyed patients and found that very few understand what pharmacogenomics mean. And if they did learn, they do not remember it. So reframing it as medicine in your DNA or drugs in your genes. Those are phrases that can be more broadly understood and might be helpful when you're trying to explain that really long, long word to patients. So when we have something pop up on a test result that is not normal, historically, we've always referred to that as a mutation in the gene. And while inherently that may be true, some people are very alarmed by that term. Sometimes someone might interpret a mutation as cool. I had a patient who thought, maybe they were an X-Man. They remember a member of the X-Men and they had something special. But a lot of patients hear mutation and they think something is very wrong. And that's not always the case. So a better term could be a variation or a difference. So those are words you can use instead of mutation. You have a variation in your DNA. Uh, Another great call out is metabolism. So in almost every patient counseling session I've had in my clinic, uh, metabolism is immediately interpreted as how you break down food and calories, and equating it to fast metabolism or slow metabolism, and weight gain, and again, how much food you're absorbing. So right away, I frame up metabolism as I'm not talking about that aspect. I'm talking about how your body processes medicine, how your body breaks down medication, and how your body removes medication. Uh, so a good thing, my pro tip from my years now running a pharmacogenomics consult clinic is to lead with that definition right away, because there's a lot of misunderstanding when you get to results. If patients are thinking of metabolism as in food, and not in drug metabolism, which as pharmacists, is probably one of our favorite things to talk about. And here's some helpful phrases to use. So, by all means, you don't need to script out every patient encounter. But when you're just getting started, I find that, this can be very helpful to refer to. So explaining in a way such as your DNA may impact how you respond to medications. Um, Genomic test results can help choose the best medications at the safest and most effective doses for you. A great way to frame pharmacogenomic testing is with safety. We can ideally identify or prevent more severe adverse events if we know how someone might respond to a medication. And that's a medication safety component. And that matters a lot to patients. Almost everyone has had an experience with an adverse event, and that really frames how they think about medicine, and starting a new medicine, and how maybe they've self-adjusted medications in the past. So driving home that these results can help us keep you safe, but also help us pick the best medicines for you. And then most importantly, do not make any changes to your medications without talking to your healthcare team first. That's depending on where pharmacogenetic test results are coming from. Maybe it's from an external source. Maybe the lab results got released into the electronic health record and the patient has seen them already. Always make sure that they don't make any changes without verifying with either their doctor or talking to their pharmacist first. So I want to share an example with you all of a patient communication. And the way I frame up how I structure my delivery of test results and communicating with patients and providers is using a 3-step method. And that is genotype, phenotype, action. So genotype, that is the test result. So what are those test results? What is the actual, lab results saying? Phenotype, if you remember, is how is that expressed? What will you see and what might you experience as a result of your genetic makeup? And then action is, what do we do next? What should the patient do? And what should the provider do? So this is a patient example. So an example, just a very general one. So this test result is a variation in the DNA that you've inherited, which impacts how your body breaks down and reacts to medicines. So again, you can see we've simplified what pharmacogenomics means, and we've explained also what that means, and also use the word variation instead of mutation. Phenotype, so poor metabolizer, we're pretending here that someone is a poor metabolizer, means your body may not break down or process this medication effectively, and it may not work as intended, and you may have more side effects. So we're explaining what that word means, what the result means, and what the patient would see or experience. And then action. In this example, check with your doctor for the final plan. Sometimes, as you all know, we get results before getting that chance to confer with the doctor. So we have to make a phone call and talk through things and get back to the patient. Ideally, we do that ahead of time, but real life here. So we're going to check with the doctor for the final plan. There may be a change in your medicine. However, remember from our last slide, do not make any changes until we've talked to your healthcare provider. So this is an example of how I structure, how I learned how to do this way back when, and then how hopefully you can start to incorporate that when you look at talking to patients. So let's talk a little bit about handouts. What should those look like? What is the best way to design those if you are looking as a clinic or a company or a health system to do so? Best practice are to use graphics, appropriate graphics when able, and really short chunks of limited text. Bullet points are great, pictures, those top 3 takeaways. And in every single pharmacogenomics handout I've ever seen and crosswalked, as I looked at creating my own, provide that glossary, a short glossary of all the terms that you're going to be using in that handout so that the patient or their loved one can look back and reference that. Don't make them hunt that down on their own. Have that right there for them. So those are some best practices as you look at patient education handouts. So to round out this section, I'd like to take a moment and have you all who are listening to have a reflection. So based on what we've gone over, what signs are you going to look for to indicate genomic literacy when you're talking with your patients? What words or phrases will you use to make sure that you're explaining the test results clearly? And hopefully some of the examples that I've walked through are helpful for you. What are those top concerns you want the patient to understand and walk away with? And don't forget that teach back, how will you double check to ensure comprehension? What I like to do is say, all right, how are you going to explain this to your, depending on what I've learned, your husband or your daughter when you go home? Hopefully we've had that getting to know each other period in the beginning of the appointment. So I feel comfortable asking, who they might be explaining this to. How are you going to document what you've done in the EHR? Most of us will write notes, whether it's internal or external for other providers to see. So how are you going to document your education session? And again, I frame mine up as genotype, phenotype, action. 1, 2, 3, short and sweet. That's what I want people to take away from my notes. And then also, what other patient resources can you recommend for additional information beyond Dr. Google? So I'll have some of those for you at the end. But pause and think. And these are the things that I would recommend you feel comfortable answering to feel competent and provide the best care regarding pharmacogenomics to patients. Transitioning into provider education and communication. So this is equally as important. There is, I would say, increased awareness of pharmacogenomics and pharmacogenetic testing amongst healthcare professionals. It's more prevalent in certain groups, certain disease states. I would say oncologists are very familiar with, all types of genetic testing, but it is becoming more prevalent in primary care, as well as some other specialty areas. I interact with a lot of advanced practice providers. They are that bridge, between the provider and the patient, the physician and the patient, and can really be useful, as far as, day-to-day and, interval patient care. So think about partnering with your APPs. And if you're going to explain pharmacogenetic testing to them, these are the words. that you should know, and that I would recommend that you teach your providers in order to be able to have these clinical conversations as healthcare providers. There's a great resource from the NIH, the National Human Genome Research Institute, the NHGRI. Highly recommend checking that website out. A lot of great materials. But this can be used to, quiz yourself and even maybe quiz some of, your pharmacy students and technicians later if you feel so. The pharmacogenomics community as a whole has also worked very hard to develop some consensus terminology, especially regarding phenotypes, to make sure that when we're delivering test results and making recommendations, we are all speaking the same language, so to speak. So on the left here of this table, you have different gene categories. We have drug metabolizing enzymes, drug transporters, and also some safety biomarkers, our HLA molecules. And then these are the recommended phenotype terminologies. So we have our, different metabolizers. There's also, depending on if it's a drug transporter, you might have the phenotype described as a function. So an increased function or normal function. And for any safety marker, it's either positive or negative. Those are a little more straightforward. But as far as drug metabolizing enzymes, which are the bulk of our results, ultra rapid, rapid, normal, intermediate, and poor metabolizer are those buckets that describe, what patients might experience and what they'll fall into when you get the results back. Here's an example of a provider communication, again, using our genotype, phenotype, action. So you'll notice right away, this is a lot more technical, but I wanted to provide an example so that you can see what this might look like. And I've chosen to use an infectious disease example to hit as many of us as possible in clinical practice. So how I might frame up a provider interaction is this patient has a CYP2C19 *17 genotype, which means the patient is an ultra rapid metabolizer of voriconazole. We're using voriconazole as our drug gene pair. So phenotype, what will we see? What does that mean for the patient? So what that means is the probability of maintaining a therapeutic trough level is low. So if our body is breaking down that medication more quickly than anticipated, really chewing through it and eliminating it quickly, voriconazole is a drug where we use therapeutic drug monitoring. We check levels, and we do want to make sure that that level is above a certain trough to maintain effectiveness. So this could result in a treatment failure and an increased risk of, a more severe untreatable fungal infection. So that's the impact. So explaining to the physician very quickly, low trough level, that means this drug will not be effective for our patient. Treatment failure. So the action would be, I recommend choosing an alternative agent that does not go through that pathway. So not metabolized by CYP2C19, therapeutic alternative. How about savuconazole? So that's what I would do in this provider interaction. I would recommend choosing an alternative agent such as this drug, along with the dose, regimen, duration. So my pro tip for, as you know, communicating with providers, short, succinct, to the point, and a very clear action plan. Pretend like you're writing the prescription for them. Discontinue voriconazole, start isavuconazole at this dose, this interval for this long. So reflection time again. What is your first step when preparing to communicate genomic information? And think about providers. What are some resources that you can use to determine that recommendation? How will you know what to recommend? And how are you going to communicate your recommendations to the provider? How does this communication differ from patient education? What were those different words and phrases that I used in my provider example from a patient example? And also, how do you evaluate provider understanding? That's also important as well. Uh, how you document in the EHR, and then what follow-up is needed after you have that interaction. So again, food for thought, especially if you are thinking about implementing a clinical service and how you'll manage those day-to-day interactions. All right, I wanted to touch on the role of the pharmacist because as our profession has evolved, we have a lot of new things happening all the time, right? Uh, whether it's new medications, new treatment modalities, new testing, a lot to keep up on. But as a member of the healthcare team, as a valued member, and as the most trusted profession for patients, what is our role? So we do have some guidance from some of our larger professional pharmacy organizations. So ASHP they put out their original version of their position statement on the pharmacist role in pharmacogenomics in 2015, and then recently updated that in 2022. And we also have some core competency recommendations from the American Academy of Colleges of Pharmacy. So what should we be including in pharmacist education? What should everyone be learning in school? And then what do we all need to, upskill ourselves on, especially if we did not get that in our training? So there are some core competencies very nicely laid out. Uh, and a quick summary, advocate for the rational use of pharmacogenomic testing. Pharmacists should be able to recognize when it is appropriate to test and how to test. Um, Being involved in interpreting those results and providing clinical recommendations is also a very large part of our job as a pharmacist, and we should be able to do that with pharmacogenomic test results. Education, not only to patients, but also to healthcare providers and the general public. That is considered a core role of the pharmacist regarding pharmacogenomics. And then also advocacy. So PSW does a fantastic job with advocacy and legislative day activities, advocating for our profession and our scope of practice. So professional involvement in organizations advocating for the pharmacist's role in pharmacogenetic testing, applications in patient care. That is considered also an expectation of the profession and highly encouraged when able. And to sum it all up, drug experts need to be pharmacogenomic experts. My dream one day is that pharmacogenomics is just like pharmacokinetics or TPN nutrition. It's a core skill that every single pharmacist has, and we can incorporate when we're doing our medication reviews and advanced pharmacotherapy. So, in summary, communication is key, and word choice matters. How we communicate and what words we use, especially with genetics, is so important. So hopefully some of those examples are helpful. If you have more examples, feel free to email me, share them with me. I'm always looking to increase my list and be the best pharmacist I can be. And we really do, need to be comfortable and competent with pharmacogenomics. So there's a variety of ways to do that. Uh, Many of you listening, if you're students or residents, you're getting that in your training. But there's a variety of continuous education, including this session, and certificate programs and resources online that I really encourage you to take time and explore so that you feel comfortable with pharmacogenomics. And then also spread awareness of genomic literacy. Again, it's a unique aspect of health literacy that we don't talk about a lot and we don't think about in our routine profile review. So as pharmacogenomic testing becomes more common, hopefully crosswalking genomic literacy will also be a routine part of your patient interactions. I like to leave in action, and my hope for you all is that you will take some time and look at some of the resources that are available. So there are some very reputable resources for patients. Again, the National Human Genomic Research Institute, wonderful resource. They have fact sheets, FAQs, the talking glossary of genetic terms. That's one of my favorites. You can click on it and hear the correct pronunciation. Really, interactive, fun resource for patients and for you all. There are some other really validated resources. I highly recommend the material from St. Jude Children's Research Hospital. They were one of the pioneers of pharmacogenomic testing, particularly in their pediatric cancer population. But all of the tools and resources they've developed, and if you're looking for great patient education material examples, highly encourage you to check out the St. Jude Hospital site. So what about resources for providers? And this includes pharmacists. So the FDA keeps and maintains a table of pharmacogenomic biomarkers and drug labeling. So you will see pharmacogenomics within the package inserts of medications, especially as it's incorporated into more clinical trials, and if there are any recommendations from the manufacturer from those trials. So that's on the FDA website. Highly encourage you all to check that out. As far as evidence-based clinical practice guidelines, the CPIC guidelines are my go-to. CPIC guidelines will not tell you who to test or when to test, but what they will tell you is what to do with the results. Fantastically curated, detailed, actionable resources, tables telling you exactly what to do based off of genotype, anticipated phenotype, and then the action, dose adjustments, different medication recommendations. So CPIC really is the core of pharmacogenomic clinical guidelines for pharmacists. And then there is a very in-depth knowledge resource database called PharmGKB. And that has very in-depth, genetic pathway illustrations, cataloging of different genomic variants, really in-depth information there. So wonderful resource. Again, can't recommend that one enough. There are also a variety of genetic professional resources. So we can't forget our genetic counselors. They're fantastic partners in clinical care. I've really enjoyed working with the team at my institution. The genetic counselors are just experts in some of those hereditary inherited disease risk conditions. And they do also receive training on pharmacogenomics, but really do rely on the pharmacists for anything really specifically medication related. So again, great partners as far as interdisciplinary care. And then we do have the American College of Medical Genetics and Genomics. They have a list of genetic specialists, tools. They write guidelines, kind of lead the field in a lot of laboratory-based aspects of pharmacogenomics. So I encourage you to check that resource out as well. So with that, I'm going to conclude our topic today on genomic literacy. Please don't hesitate to reach out. You have a new pharmacogenomics friend. And I know that when I was going through the implementation process and building my clinical services from the ground up, it was so helpful to have someone to talk through things and bounce ideas off of. So appreciate your participation in this webinar today. And again, don't hesitate to reach out if you have any follow-up questions at all. So thank you.